Hello people, in this video we will look at this forensic topic, very important, causes of death in case of burns. Okay, so basically burn is an injury which is caused by application of heat or chemical substance to external or internal surfaces of the body, which causes destruction of tissues. Listen again. So it is not just this fire kind of thing, it can be a chemical also. So it is application of heat or chemical substance, either it is applied externally or internally, and it causes destruction of tissue. So that is what is burn. It's an injury they are calling it as. Now what are the causes of death? Why will a person die? Immediate causes, delayed causes, remote causes. Immediate causes, basically there can be a neurogenic shock. Primary or neurogenic shock can be there. Because of the pain, the person can die. Because of fright. And this death can happen within few hours. Okay. The next thing is asphyxia. So lack of oxygen, right? Suffocation from inhalation of carbon monoxide, carbon dioxide, cyanide, or falling from a building, because of this attempt to escape. That can also cause traumatic asphyxia. Carbon monoxide especially is the important cause of death in most fires, okay? So you have seen carbon monoxide poisoning in other videos. Moving on, others. So they're just saying smoke, heat-induced laryngospasm, respiratory arrest, vagal reflex caused cardiac arrest are the other causes which are immediate. So what are the immediate causes, guys? Neurogenic shock, asphyxia, others like cardiac arrest, laryngospasm, respiratory arrest. Now coming to the delayed causes, here they're saying it is secondary shock, so hypovolemic shock, burns or secondary shock, okay. So basically this accounts to greater than 50% of the death. So in 24 to 48 hours due to loss of fluid and protein and multi-organ failure, there can be death, okay. The next thing they are mentioning here is acute edema of glottis, okay. So acute edema of glottis due to inhalation of irritant smoke or hot gases with or without pulmonary edema. So inhaling a lot of irritant gases and smoke, and this can cause acute edema of glottis, which can cause death. Then there is going to be respiratory failure. Respiratory failure is written here as a delayed cause. So basically inhalation, injury, pneumonia, then acute respiratory distress syndrome, ARDS, significant cause of death within 3 days. So here delayed means they are saying 1 to 2 days. Immediate means hours, okay. Basically hours is immediate. Delayed is like a day, okay. Then coming to the other causes after respiratory failure, they are saying toxemia. Toxemia is due to absorption of toxic products from burnt surface causing death in about 3 to 4 days. Okay, so absorption of some toxic substances. Then sepsis. Sepsis. Okay. So now sepsis, basically the most important cause of death occurring in 4 to 5 days or longer after burn. Septicemia can be caused by burn wound infection, Pseudomonas aeruginosa, other gram-negative bacteria and even Staphylococcus aureus, pneumonia, UTI, urinary tract infection, followed by following catheterization, infected IV lines, infection of skin donor sites. So this is a very, anyways it is bacterial infection which can be because of the infection caused at the burn wound or because of catheterization, IV lines, skin donor, etc. Okay, finally it's because of the bacteria. Then biochemical disturbance. Biochemical disturbance. So biochemical disturbance means secondary to the fluid loss and destruction of tissue. Hypokalemia they are saying. So hypokalemia will kill the person. Next point here, acute renal failure. Acute renal failure can cause the person's death in few days. Due to nephrosis of lower nephron, it occurs 3 to 4th day, the person can die. Gastrointestinal disturbances. The next one is gastrointestinal disturbances. So GIT disturbances, acute peptic ulceration, dilatation of stomach, hemorrhage into intestine. Last one is infective complications. We have already seen sepsis, but anyways, again they have written infective complications. So basically infective complications means bronchitis, bronchopneumonia, enteritis. Okay, bronchitis, bronchopneumonia, enteritis they are saying. Now guys, we will move on to the remote causes. Are you awake? So what are we looking at today? Burns, causes of death in burns. We have finished immediate causes, we have finished, right? We have finished the delayed causes. Now we are going to remote causes. In immediate, what did you see? Neurogenic shock, asphyxia, others. In delayed, what did you see? Some sepsis, toxemia, respiratory failure, acute edema of glottis, hypovolemic shock, biochemical disturbance, acute renal failure, gastrointestinal disturbances, infective complications, sepsis mainly you can remember. Okay, then coming to remote causes. Remote cause. Now, remote causes, they have mentioned complications like anorexia. What is this? Complications. Anorexia, how? Hematemesis, indigestion, respiratory complications, melena. Interesting. Then suppurative discharge. From where? Infected burn areas. Isn't this the same as the sepsis what we saw? Last for weeks or months. So basically they are saying weeks or months. After that they will die because of complications. Okay, then others they are saying gangrene, tetanus, anemia, edema of dependent parts and jaundice. Lastly they are saying embolism. So embolism I thought will kill immediately, but this is a very remote, they are saying fat embolism, pulmonary embolism from thrombosis of veins of legs due to damage and immobility. Okay. So they have put it in remote. Anyways, we'll leave it there. You can challenge it if you want and say this embolism can be immediate, right? Anyway, so now we have looked at the causes of death in case of burns. It's an important question in forensic science. Immediate causes, you have seen neurogenic shock, asphyxia, others. Delayed causes, hypovolemic shock, acute edema of glottis, respiratory failure, toxemia, sepsis, biochemical disturbances like hypokalemia they have mentioned, acute renal failure, GIT disturbances, infective complications. Coming to remote causes, guys, remote causes will be like because of complications like anorexia, hematemesis, respiratory complications, melena, indigestion, suppurative discharge from burn areas, others like gangrene, tetanus, anemia, edema, embolism, you have seen fat embolism, pulmonary embolism. Okay. So we have covered this topic for you, forensic cause of death in case of burns. Okay. See you in the next video, guys. Bye bye.